We're called James's Place because our service and our charity was developed following the death of a young man called James. Charity was set up by his parents, Nick and Claire. Claire, I think it's safe to say, had a real vision of a place where at that moment of a suicidal crisis that James would be able to go and get the help that he needed pretty much straight away. And I had been working in the NHS up to that point and had a view that a talking therapy delivered at the point of crisis would be a safe and effective way of supporting men from the point of suicidal crisis to pretty much the point of recovery. Referral comes in and we have set ourselves a specific time frame for when that should be responded to. You know, we reach out straight away to make appointments and to bring them through, but we need to record that we've done all that. So that was all happening on a big spreadsheet. You know, when a referral comes in, what can happen to that referral? We either don't take it or we do take it, or we need some more information. So those are the outputs of that first interaction. What's the outputs of the second interaction, the third interaction? So that timeline goes across the top of every page that a therapist opens related to a client episode of care. And so even that first glance, they can see that the person's, you know, they're in treatment, they've had so many appointments and they've been with us for 28 days. We've got like auto-generated GP letters and auto-generated reminders, all things that make it less and less likely that a man misses appointment or that they don't get the information that they need, or more importantly, that their GP doesn't know what's happening to them. So the way that we were able to configure the system was to pull all of those things in so that they all happen without a therapist having to remember, right, I've got to send a GP letter now. Now we moved on to doing the Power BI work. You know, we're able to look at trends across centres. We're able to look at trends. You know, I could work out whether is Monday a good day for us to do therapy. Do we get more DNAs on a Monday than we do on a Thursday? Should we close on Monday? You know, it's those sorts of questions now that we can ask ourselves in terms of service delivery, because we've now got the data. You know, that's really easy to access.
In a typical day, we can see, you know, up to 5 men in suicidal crisis, and that's a really emotionally challenging role to be in. And if we had a difficult system on top of that, that's, you know, to record our notes and record our risk assessments, we're going to be quite limited for the amount of time that we're able to prepare for sessions and also then get, you know, ready to support someone else through a suicidal crisis in their family. So the system being streamlined and easy is brilliant for us because we can make, you know, quick notes. You know, we use drop-down options in order to help us do our risk assessments as well. So I think that transition from after the session finishes, completing our notes to moving on and preparing to support someone else, that's a really easy transition for us and just, you know, helps us overall on our performance.
The feedback from the therapist has been universally positive. It has been game-changing, I think, in lots of ways for us.